Mental Health in Times of SARS-CoV-2. An educational audiovisual non-profit video clip produced by Mexican undergraduate students in their fifth semester of the Bachelor in Neuroscience imparted at the Faculty of Medicine of the National Autonomous University of Mexico.
If you were asked to list the most important elements of your life, what comes to your mind? Your family, a trip that changed your life? What about your partner, maybe your pets, or the career you chose? Now, let me suggest you something else, something on the bigger picture side of things. What about your mental health? The COVID pandemic has marked a turning point. Our world has changed. On March 11, 2020, the General Director of the World Health Organization, Tedros Adhanom Ghebreyesus, declared SARS-CoV-2 a pandemic. Ever since then, light has been shed on several crises within an international context, including deficiencies in the public health systems. Initially, the focus was on attaining patients' physical health. However, very soon mental health institutions had to attend not only to the regular patients, but to the general public that was negatively impacted by the pandemic. In view of this appalling reality, mental health was found as a short-term risk, as an adaptive response and one of natural preparation before the possibility of losing one's life. The population was under acutely stressful situations. Similarly, given the innumerable deaths and the impossibility of carrying out funerary rites that would, as a consequence, generate big crowds, the traumatic conditions associated with health emergency were inevitably intensified. In addition to the uncertainty, there was an impact on personal finances, xenophobia, excessive exposure to media, also referred to as an infodemic, among other stressful factors.
This environment of natural and adaptive stress led to the development of psychological issues including behavioral, emotional, and cognitive alterations. These issues undoubtedly impair a person's ability to face reality like usual. Some of the consequences include loss of appetite, fatigue, sleep disorders, irritability, anxiety disorders, post-traumatic stress, fear, impaired attention span, memory deficits, and a heightened risk of self-harm and suicide. These conditions, combined with the use of psychoactive substances or with exposure to contexts of violence, result in serious mental health problems for many in the short, medium, and long term. The observations of the author Moreno Proaño, Vivanco Vidal, and his collaborators in 2020 revealed that anxiety in such a high degree derived from this imbalance, causing people to confuse benign muscle pains with pains typical of the disease, in addition to causing panic and other maladaptive behaviors including social withdrawal and compulsive purchases that affect the community at large, mainly when excessive expenses were made for the storage of resources. Multiple investigations have reported that anxiety and stress increase cortisol levels, inhibiting the immune system and making the body more vulnerable to viral and bacterial diseases. This was the scenario that was lived day after day during the pandemic. In this context, different surveys conducted throughout 2020 showed that those most affected were women and teenagers.
For example, in a study conducted by UNICEF in which anxiety and depression tests were conducted on 8,444 teens between 13 and 29 years old in 9 Latin American and Caribbean countries, showed that 27% of the participants suffered from anxiety and 15% from depression. The main reason for these emotions was concern from the economic situation they were going through and their future. Approximately 1 in 2 participants showed less motivation to engage in activities they used to enjoy, and only 1 in 3 participants asked for help from a relative or a close friend. In Mexico, in particular, significant symptoms were associated with the pandemic, bereavement, or with depression diagnosis prior to contracting COVID-19, and need to be addressed in addition to a high association with acute stress, generalized anxiety, sadness, and anger. An exponential increase in the use of alcohol was also reported, as well as episodes of physical and emotional abuse linked to mental health risk conditions. It is worth mentioning that in Mexico, there are 3 health professionals for each 100,000 inhabitants. And although the situation had improved by the end of 2021, a lot of people still can't receive the attention and the support they need for their pre-existing mental health afflictions and the new ones that develop. The ethical implications this brought with it include how the lack of access to face-to-face care leads many people to seek online help, meaning that digital tools, reliable and effective, need to be urgently available and easily accessible. However, developing and implementing digital interventions is still an important challenge in resource-constrained countries and environments, as is the case for Latin and Afro-American communities. In addition, the development of these resources leaves behind people in vulnerable conditions who do not have internet service or electronic devices.
In an attempt to treat those with a better prognostic while facing this health crisis, those with severe mental illnesses, learning disabilities, and neurodevelopmental disorders were left behind. Parallel to this was the popularization of telemedicine, which has elements that have not been subject to reflection or regulation given the urgency of the crisis, such as privacy, security, and access. Information shared through digital means for mental health treatment is of particular importance, as it is highly sensitive for those who share it, and it could be used for negative purposes by the government and the industry. Given the lack of regulation, it will be difficult to hold the developers accountable for the possible negative effects these alternatives offer. Another ethical debate arises regarding the doctors and other health professionals' attitude, disposition, concrete actions, and decisions in the face of excessive demand for their services. Under these premises, the World Health Organization has highlighted that while the pandemic has generated interest and concern for mental health, it has also revealed historically insufficient investment in these services. Countries must act urgently to ensure that mental health support is available to the general population. In this regard, we propose some possible medium-term solutions, such as generating research lines to identify and attending prevention and attention to the most relevant social patterns and effects of the virus at a neurological level, which can help understand the presence of mental health disorders such as depression or anxiety. Evaluating the effects of remote psychosocial interventions at all levels and risk orders that have been carried out in Mexico and the world. This way, all implemented policies will be based on scientific evidence.
Supplying comprehensive and integrated mental health services that have a strong response capacity. Providing security and safeguarding both the workforce that responds to these cases and works in adverse situations, as well as vulnerable populations due to age, past medical history, poverty, etc. Additionally, the considerations raised in the updated 2013-2030 Comprehensive Mental Health Action Plan, which was created in an assembly by different countries under the objective of meeting the needs of this sector, should be included. Providing comprehensive, integrated, and responsive community-based mental health and social care services, procuring greater coverage to help raise awareness towards the benefits of accepting and treating mental health problems over hiding them for fear of persecution. With the help of mass media, implementing advocacy and prevention strategies in the field of mental health. Strengthening reliable information systems, scientific data, and research. Systematically calculating and reporting on mental health indicators in the population, simultaneously encouraging the participation of scientific research to monitor them. Your mental health is as important as your physical health. Everything we do is a step we take. Let's care for your care.